Hi there and welcome back. In this presentation series, we are going to be talking about hematology as it relates to individual life underwriting. Hematology, as we know, is the study of blood and variety of blood disorders that we frequently encounter in our daily routine and how it affects the bottom line extra mortality when we do the individual life underwriting. So that's what we will focus on in this presentation series. So let's get started. Needless to say, we know what is hematology, so let's move on. In the next slide, we will see the different breakdown. So I have come up with a kind of like this strategy. So for example, if I say that Mr. So-and-so has too many red blood cells and another person has erythrocytosis, what does it mean? Unless you know that too many red blood cells or erythrocytosis means one and the same thing, you may not be able to follow what I am talking about. So it is important that we need to understand the language of medicine. So lots of literature out there, but what we will do, we will try to focus on the key elements or the key terms that you need to know to better digest and grasp the anatomy and physiology as it relates to hematology. We talk about and we hear every day in the TV, radio and newspaper about new drugs being out, lot of research being done to better assess and diagnose and treat variety of malignancies, cancer, even to control our blood sugar level. New drugs are coming out every day. Hats off to the scientists who work day and night and come up with those new strategies and the treatment plans and options. But bottom line, as of today, as we speak, we cannot create artificial blood. So what is the composition of the blood? How blood is formed? What are the ingredients in the blood? That we want to understand. And frequently we know that we go to the blood drive for blood donation, things like that. We love to do that, but then we always hear that, well, you just can't give your blood to anyone. Your blood has to match, the blood of a donor has to match with the blood of the recipient. So what are the rules, what are the types and the caveats when it comes to the blood groups? And when we look at any human being, the average weight, what's the typical blood volume in our body? That's what we want to understand. Moving on, we will try to scratch the surface on blood clotting. If my blood is too thin, is it good? I may have a frequent bleeding, even with a minor cut or a bruise. Can I have a thick blood? Well, too much clotting can lead to, you name it. You could have a DVT, a blood clot in your extreme artery, peripheries. You can have blood clot anywhere, in your lungs, in your heart, in your brain. So how to strike the balance, what our body does to make sure that there is a balance, check and balance of both. So what is the blood clotting process that we will get into? Hematological disorders. Lots of disorders are out there as it relates to blood. What we will do, there are many, so I am going to confine to those that we frequently encounter in our daily underwriting routine to help you out. Lab test. In the industry, we see some typical lab tests, but if you ask any doctor, they will say that there are thousands of tests out there and on as needed basis those are being done. Okay, but we will look into variety of lab tests, the clinical procedures from a simple blood donation, blood transfusion to better diagnose the variety of disorders of a needle biopsy all the way to the bone marrow transplant can be done. So there are various clinical procedures out there. We can take a look at those details as well as we move on in this presentation series. Then, as we know that there is a difference between clinical practice and industry-wide underwriting applications. Anyone goes into the ER, the doctor will check their CBC, but he is in the ER because of the chest pain. So, believe it or not, for whatever reasons, the CBCs are frequently ignored because the focus of the admission to the hospital or ER is different. And doctors have some privilege, some flexibility. Oh, you are low on iron, come and see me, take the iron pills, come and see me after a couple of weeks, so on and so forth. We, in underwriting, we cannot do that, right? So there are some differences. We have to go with what we get. Of course, the medical records are the best source to better look at what we are dealing with. So in the next slide, we will see what are the other things as far as the hematology goes that we need to pay close attention to. First and foremost, we want to make sure that any abnormalities in the blood, in the CBC that we encounter, okay, are the findings, not the diagnosis. And let me explain that. What do I mean by that? Let's say the abnormalities in the CBC, whether you have got too many red blood cells, erythrocytes, or too many white blood cells, say leukocytosis, or you have got too many platelets or thrombocytosis, and or other way, you have got very low platelets or thrombocytopenia, or you have got leukopenia, too many low white blood count, or someone is anemic, red blood cells are low, iron is low. Those abnormalities can lead to, for example, a blood clot in the lower extreme periphery that we call DVT, deep vein thrombosis, right? Now, when you look at in the medical records DVT, you recognize and realize that there is extra mortality. Or the same abnormalities may end up with having a clot in your lung, pulmonary emboli, or if that blood clot gets into your heart, it may lead to MI, heart attack. You see the extra mortality right there, and it could happen in the brain that may lead to stroke. So while reviewing the hematology and the hematological disorders, that is the first thing, that those are the findings, not the diagnosis. So you look for the ultimate cause, look for the ultimate diagnosis as opposed to simple CBC. Although having said that, having anemia is not a diagnosis, it's a finding, but having anemia per se brings extra mortality on the table. But you don't want to stop there, you want to go beyond and find out what is the root cause. And in addition to other abnormalities, after following your company specifics and the underwriting manual your company expects you to follow, look for the ultimate cause, ultimate diagnose, and rate for the cause. That is the central idea as far as life underwriting goes and study of hematology or the study of blood. Sometimes we are stuck and we don't have the liberty to have all the details in front of us, right? And generally in the industry, nobody would encourage you to go out and get the CBC. Why is that? Well, there are reasons. The way the transportation and the processing of the CBC takes place, it's very sensitive. And you will normally not see CBC being used in the industry as a routine requirement. And there is one exception, and that exception is hemoglobin. So hemoglobin you will see in the industry, but normally nobody would encourage you to go out and get the CBC on a routine basis. The medical records would be the source to look upon when you are dealing with cases like this. But while doing so, what you want to pay attention to, someone may be borderline anemic. You may not recognize that because there are various lab tests and various definitions of what is considered normal or borderline normal. But look at the trend to see how it was 2 years ago, how it was last year, and what do you see now. So look for the trend to better digest and grasp the abnormalities when you look at the CBCs. That is another important thing that you want to pay attention to. And of course, the response to the treatment, the stability, those are the details you want to pay attention to. Additionally, look for the signs. Are you having just one red blood cell abnormality or there are multiple line of cells? Those are also abnormal as well. Or simply speaking, pancytopenia. Do you have enlarged spleen, a lymph node, weight loss? Those are the additional risk factors or the red flags that you want to look out for. Okay? So what we will do, we will get into each and every details of the hematology one by one, and we will move on with the next video, and we will take one at a time to dissect and see what it is and how to move on. So try to consider these aspects in general, but moving forward we will get into each and everything, and we will start with the language of medicine. That way we talk the same language and we will move on. Okay? See you soon. Take care. Bye now.